Hello everyone, it's May the 27th. I'm Dr. Adam London, Director of the Kent County Health Department, here for today's COVID-19 update. Across the state of Michigan, it's now reported there are 55,608 diagnosed cases of COVID-19. That's an increase of 504 over the previous day, and 5,334 deaths in total statewide, an increase of 68 over the previous day's number. Here in Kent County, we're at 3,420 diagnosed cases, an increase of 35 over the previous day. So we continue to see this slow downward trend. On April 29th, which is the date that I think we had our peak here in Kent County, give or take a day or two. But on April 29th, we had a 3-day average of 126 cases. Now we're down to a 3-day average of 30 cases. So you can see that we have trended downward pretty noticeably. There have been some ups and downs as we've done that, but overall our trend is definitely in a downward fashion, and that's fantastic. Our death count in Kent County is at 72. That's an increase of 4 over yesterday's number, which is concerning, and our thoughts and prayers go out to those 4 families. But we know how devastating this is to so many families. People are wondering, why are we seeing a decrease in cases, but actually a slight increase in deaths recently? And there are a couple of reasons for that. We have seen some small outbreaks in long-term care facilities where people are the most vulnerable. We also know, of course, that deaths follow cases. And so many of these deaths that we're seeing now were cases that were diagnosed during that peak in late April and early May. And so the deaths, unfortunately, are catching up with that now. So the wave in deaths will follow the wave in cases by a few weeks. Moving on to some good news, however, we're now at 1,695 recoveries in Kent County, which means that we now have more recoveries than we have active cases. We have 1,653 active cases. So for the first time, our number of recoveries has passed the size of our number of active cases. So we're seeing overall our community is trending in a very positive way, which is good news. For a lot of reasons. The governor has shared the My Safe Start plan yesterday, and these good measures are going to be important to us in Kent County and throughout the Grand Rapids region, which includes many of the counties in West Michigan. As we look at moving from one phase, we're in phase 3 right now, into the next phase, phase 4, like the regions in northern Michigan are at. And there are 5 areas that are included in the metrics in moving forward in this plan that I want to briefly mention. The first is reducing the case rate to less than 20 cases per million of population per day. So on May the 1st, here in the Grand Rapids region, we are at 93.2 cases per million of population per day being diagnosed in this region. We're now at about 57.9 total cases per million of population per day in this region. So we're trending downward. We're not near the goal that she has, though, for moving to phase 4. Again, the goal is 20, and right now we're in the mid-50s. So we still all have a lot to do to make sure that we're making it difficult for this virus to spread so that we can get that number down low enough to move on to the next phase. The second area is increasing the testing rate. So right now in our region, we're testing at a rate of about 1,400 tests per million of population every day. The goal for moving to phase 4 is having 3,030 tests conducted per million of population per day. So we need to do a little more than double the amount of testing that we're doing right now. And while I have lots of capacity, we need to make sure that we're opening the eligibility so that all asymptomatic people can get access to testing as well. We're making a lot of progress along those lines. In fact, we're going to have some announcements to make later this week about some testing sites we're going to be opening in the community beginning next week so that people can get better access to testing. That's going to be part of the solution in making sure that we have broad testing available throughout the community so we can hit that number, and most importantly, so people can get diagnosed quickly, can isolate themselves, and prevent the spread. The third area is the positivity rate. What's the percentage of these tests that are coming back positive? The goal for stage 4 is having a positivity rate less than 10%. And right now we're already there. We're at about 9% right now. So while we're there, we need to make sure that we don't see a resurgence in cases that pushes us back over that line. So expanding testing, doing what we can to prevent the spread is going to help keep that positivity rate low. The fourth area is public health capacity. And do local health departments have the ability to do contact tracing and case investigation in a timely way? And I'm happy to report that right now we are getting to all of those cases within 24 hours of notification. That's important so that we can find out who is in contact and we can do isolation and quarantine in a timely manner. So I think we're standing good with that fourth area. And the fifth area is hospital capacity. What kind of room do our hospitals have? What kind of ventilator capacity do they have? Are they feeling that they're in a strong position to move on to the next phase? Right now, I've spoken to all of our hospitals here in Grand Rapids. They are all feeling as though they're in a strong, stable condition and that they're ready to move on to that next phase. So we're looking good on many of these areas. The one area that we do need to work on especially is that case rate and then the testing rate also. Now here's where we need your help. That we all have a role to play in this, and while we can do our part in getting more testing available, we need everyone to continue avoiding large gatherings, wearing masks if possible, washing hands, maintaining that 6-foot separation. If we do that, if you do that, together we can make that rate go down and we can move on to the next phase in this reopening in the My Safe Start plan. So I encourage you to do that, and I encourage you to stay positive, stay heroic, stay healthy. I'm Dr. Adam London with the Kent County Health Department, and I'll talk to you again tomorrow. Thank you.